Our services basically comprise of medical treatment and skilled nursing care for severely disabled patients. Typically, our patients would be dependent on tube feeding, they would be bedridden, immobile, require preventive care against bed sores, against pressure wounds. They may also require clinical procedures such as tracheostomy and urinary catheterization. Certain patients may require long-term respiratory support and ventilation, and we have provided care for these patients on several occasions. Since many of our patients are frail and severely disabled, our resident occupational and physiotherapists provide comprehensive rehabilitation service for inpatient and outpatient services. For patients who are medically stable and can be discharged for home, we also provide comprehensive caregiver training. Such training would ease the burden of caregivers and help in preventing certain complications once the patient has returned home. Within the Klang Valley area, we also provide home care services, wherein our doctors, nurses, therapists would attend to patients requiring various forms of consultation and treatment. Additionally, we assist families with procurement of medical supplies, medical equipment. What we do is we provide diapers, milk, consumable items, and we use these items in large quantities, hence making it very affordable for our patients. We also provide rental for medical equipment such as hospital beds, pressure relieving mattresses, and oxygen concentrators. As I mentioned earlier, most of our patients are frail and or severely disabled. They may include stroke victims, patients with traumatic brain injury or spinal cord injuries. There may be advanced stages of Alzheimer's or Parkinson patients that do get admitted as well. On some occasions, we deal with terminally ill patients where all forms of cancer treatment has been exhausted and our scope of treatment is limited to palliative care. Conversely, we do attend to many patients with temporary disabilities. For example, those who have suffered from recent hip fractures or those who have undergone joint replacement surgeries often get rehabilitated to the point where they can live independently at home. In general, acute hospitals usually manage acute conditions. Once a patient is stabilized, he or she will be able to be discharged. This would allow the hospital to clear its bed and admit more patients who require treatment. The actual problem arises when the patient has been treated and stabilized but has not sufficiently recovered to the point where he or she can easily manage at home. That is where we come into the picture and assist with the recovery process. Some of the advantages of extended care would include lower rates of cross-infection in comparison to an acute facility. The patient is able to receive long-term care in a hospital setting at a lower cost. The patient will continue to receive medical care by resident doctors. Complications, if any, is easier to be detected and managed in a prompt manner in a hospital setting. And of course, the availability of emergency medical equipment where opposed to being at home again. There is also availability of in-house rehabilitation services and equipment. Again, this is opposed to home setting where things are not, or rather services are not easily available. Longer visiting hours, which is from 7 a.m. to 9 p.m. to suit the convenience of family members.
The rehab team at Columbia Asia Extended Care consists of an occupational therapist and physiotherapist, and we provide comprehensive holistic rehab services at high intensities of training. Basically, we try to speed up functional recovery at the soonest. Our team here uses equipment like the parallel bars, pedals, tilt tables, balance board, and hand function equipment to help patients regain functions that they have lost. Our services do not require a lot of sophisticated equipment because we are more hands-on. We use a lot of manual handling because this may actually benefit our patients better. We use assessment tools to continually assess our patients, and they serve as a guide towards achieving maximum potential. Someone who has just recently suffered from a stroke or a traumatic brain injury will need extensive rehabilitation. These events usually leave a patient with residual neurological deficits that impair their ability to carry out activities of daily living like bathing, grooming, getting dressed, walking, even talking, for example. Our primary role here is to help them regain as much function as possible with the aim of returning to their normal lives. Usually, the window of opportunity for recovery after a stroke is within the first 3 to 6 months. And after a traumatic brain injury, this period may be up to a year. Hence, it is of the utmost importance to start rehabilitation early and be as intensive as the patient's condition may actually permit. Generally, rehabilitation starts once a patient is medically stable, and that's usually within the first 48 hours in an acute hospital. But in most acute settings, when a patient is discharged, they are medically stable. But how does someone who is temporarily incapacitated manage at home? How do they get in and out of bed? How do they go to the toilet? How do they get dressed? And if someone is able to walk but is unsteady, they are at very high risk for falls and other injuries, which will end them back in the hospital again. And how does the family cope? Columbia Asia Extended Care Hospital is an option for such patients. Once they are discharged from an acute hospital, these patients can be transferred here, where we will resume intensive rehabilitation and assist them in their recovery process. Our step-by-step rehab programs push patients within their tolerable limits to be independent or as independent as possible in their home and work environments. We train them and supervise them 7 days a week on how to carry out all activities of daily living, which include getting in and out of bed, walking, dressing, having a shower, climbing stairs, eating a meal. This ensures a better quality of life for the patient as well as significant relief to their caregivers and family members. We also are able to help orthopedic patients who have been immobile for various reasons. Prolonged immobility causes muscle wasting, and despite successful orthopedic surgeries, many patients are unable to return home and resume functional lives. Furthermore, correct techniques to sit and stand and get in and out of bed are vital factors in ensuring that prostheses do not dislodge after surgery. Bedridden patients also require rehabilitations. There are many reasons why they would, but contracture management is one of the most crucial aspects for such patients. Contractures are basically the stiffening of joints and the shortening of muscles. And when such things happen, nursing care, hygiene care, and grooming would eventually become difficult and in some cases impossible.